Welcome to Inside Out, the podcast about badass millennials living out their dreams and how they got there. I'm your host, Jane Z. Welcome back to the podcast. Today we have our final amazing guest of season 1. Next week, I'll be finally sharing my story to wrap up our season. I'll be sharing all about my journey with startups and entrepreneurship, how I got started with my own business when I was 13, how I helped design a student-run cafe at my university, and then going on to co-found the first ever classroom design platform for teachers, and why I decided to quit my job to work on this podcast. I'm excited to share some of my story with you guys and what I've learned over the years, so stay tuned for that next week. In the meantime, today's guest is Vivienne Walz. She's a public health professional who was just last year working on the Ebola response for the CDC out in the Democratic Republic of the Congo. She was working as an evaluation fellow, which we'll go into what that means. When COVID hit, Viv repatriated back to Canada last year, and she's now been working on the COVID response in the Kahnawà Mohawk territory, which is a First Nations reserve outside of Montreal. In this episode, we talk about Viv's experience growing up on a Swiss farm in rural Ontario, how a documentary series about First Nations reconciliation in Canada really set off her whole career, and what it was like working at the CDC and on the Ebola crisis. Be sure to let me know what you think about this episode in the comments below or on Instagram at Inside Out with Jane. And with that, enjoy the show. So let's start from the beginning. I'd love to start with your childhood and upbringing and, what it was like growing up in a pretty Swiss family in Eastern Ontario.
Yeah, so I immigrated with my parents when I was a baby, and it's kind of like a unique story because my grandparents and my mom's siblings were already in Canada, and my parents decided to join them about 10 years after they had immigrated. My mom's family wanted to start farming in Eastern Ontario, and they were farmers in Switzerland, but my grandparents' dream was to have a bigger farm in Canada. So I grew up in Canada, but with all my Swiss family around, and in rural Ontario. I grew up speaking Swiss German with my parents, and my grandmother especially, who also moved to, after she retired, also moved from Switzerland. So I had 2 sets of grandparents with us. And I think the Swiss values came up a bit later, like order and work, could also be farmer values more broadly, and then just little traditions, holidays, food. We definitely eat a lot of cheese, relatively speaking.
Yes, so good.
And I was having dinner at 6:00 and spending a lot of time with my grandparents.
What kind of farm did your grandparents have?
So they had dairy cows and crops, and at one point somebody was also farming pigs.
Did your family ever make your own cheese?
Not that I can remember, but I remember drinking whole milk at my grandparents for breakfast that they had gotten from the farm, and we had to skim it using a strainer because all the fat was on top. Yeah.
How does that work? Is it literally a strainer and you pour it through, or?
We use kind of a strainer you would use for tea.
I'm gonna fast forward a little bit to your / our McGill experience. When you think of your McGill days, what's most prominent and stands out to you?
What I remember from day one is how much emphasis there was on critical thinking, and kind of at the end of my time at McGill, I came back to that, and especially in my master's, because I did my bachelor's in arts and science, cognitive science at McGill. And then I did a master's of science in public health. There are certain key courses that just really opened my mind and made me question a lot. I think I learned so much from my peers who just came from different walks of life. And growing up in a small mostly white town, I knew there were other ways of living, and people could have different values, and I appreciated that to some extent. I was reflecting on how much more I can appreciate that and navigate diverse contexts. I remember attending a conference in my second year. It was something like the Interdisciplinary Conference on Education. And then there was one lecture offered by somebody from the First People's House at McGill. He showed us the documentary series by CBC called Eighth Fire. And that was like just such a good introduction to the impacts of colonization on Indigenous peoples in Canada, how it touches like many parts of their lives and how those impacts like persist. And it gave me motivated me to see how I could get involved like in a helpful way and like not repeat those patterns or like support those systems. It led me to want to learn more, most of all, and like apply it in my studies, because it was such a like a broad picture. It touched on education, but like language, and I was studying linguistics and languages, and touched on health, the environment, like so many things. So I really remember that and like think back to that a lot. Like I'm just so glad that I went to that conference kind of randomly, like started me on like this path.
I'm a very visual learner, so I'm trying to picture the images that you saw. Was there like certain clips that you remember like hitting you the most?
Definitely the residential school system. And I think the fact that the last one closed in 1996, like after my brothers were born, that was like, wow, that's our generation. And it's like thinking about people's like grandparents who've survived and like people's parents who've survived, and just making those connections, I guess, like visualizing the families affected. The images of people like being interviewed in nature, I think of those as well. I remember like kind of taking a trip along with them as they travel to different communities and talk to people.
I want to hear about your time in Australia, because you spent some time studying abroad there, and you also got to do an internship in Kahnawà related to Indigenous culture and languages.
Yeah, like I would say that conference planted a seed. I kind of landed on Australia because I wanted to keep my options open in terms of like going to med school possibly. So I wanted to still meet those prerequisites. I chose like an English university, and happened to be that Australia was like far away. Really interesting. I knew like almost nothing about it. Yeah, the University of Melbourne just seemed like a cool school to go to, had interesting courses, and Melbourne seemed like a nice city. So it was quite an adventure. Like my first time living in a different country as an adult, and having to like adjust, set all that up, all the minutia of like bank account, phone, booking flights, organizing travel, or like just winging it a lot of the time. And while I was there, like I took a class, I think it was Introduction to Aboriginal Languages. Aboriginal is like the term for like the first peoples of Australia. That course like really got me interested in doing applied linguistics work. For me, that meant doing an internship in Northern Australia. And there was a language and culture center, the Miramadawang Wulapgaring Language and Culture Center in Kahnawà, Australia. So I was able to get set up with an internship there, and I traveled up there and stayed there for a few months while taking a semester off from school.
How did your experiences in Australia kind of shape what you did when you came back? And maybe this is a good chance to talk about your work in Kahnawà and the Dalai Lama Fellowship. But I know you were involved in a lot when you came back to McGill.
Yeah, definitely like I had senioritis in the sense of like FOMO, like really hard, fear of missing out. And I ended up taking an extra semester just to round out everything I wanted to do, which was like too much looking back, but something I had to learn. I don't know, I thought it was bad to give up, but really like looking back, there were like certain things that happened. Like I was like hit by a drunk driver while on my bike and broke my foot, and that could have been the trigger to like just drop more things and just focus inward and on healing. But I think staying busy like really helped me cope as well, and like kind of put it off. So yeah, I'm trying to like stay compassionate with my younger self.
Yeah, I remember that was a tough winter, and we were roommates. Looking back, I don't know how good a roommate I was, to be honest, but I remember when I got that call and you were like, "Hey, I'm at this and this street corner. I just got hit by a car." And I was like, "Holy shit, like let me come over there right now." And it was crazy. And And afterwards, you still had to deal with all the drama of like insurance and like not
Mhm.
getting paid out. But it was crazy. Like you were riding your bike, wearing your helmet, thank God. And well, maybe you tell a story because I remember what you told me, but you you went through it.
Yeah, yeah, I was riding my bike like almost home where we lived in Milan, and there's this like one place where there's several lanes that sort of merge, and there's no bike path. So it was right around there where like all of a sudden I find myself on the ground and like this car drives over my foot and my bike. And luckily like I fell to the side, you know. It turns out like a drunk driver hit me while I was riding my bike and I was in front of her. Yeah, I was just like on the side of the road, like basically waiting for the ambulance, like staying still just in case I had like a neck or a spinal injury. Really glad that I was wearing my helmet because I fell like right on my head. um,
Jeez.
and then yeah, I think some good Samaritans like stopped and like stayed around me. A couple like witnesses stuck around who saw it happen because I didn't see anything, and called you and called my parents. And yeah, I was really lucky because like it was a pretty small fracture on my foot, and it's, I mean, it's been a few years, it's been like 5 years, and it's mostly healed, but like I still get a little pain sometimes. But um yeah, just it was tough to like on top of everything else, I guess, deal with all the paperwork you have to fill in, like trying to get better.
Mm,
Definitely gives me a lot of like empathy for people who have to go through that, or like have a, you know, a more serious experience. Like it's a lot.
hmm.
And yeah, you have to like be your own advocate and stuff. So
Did you ever get that case resolved with the driver?
I I had some interactions with the prosecutor like a few years later.
Mm,
Um, but I'm not sure what happened in the end, actually,
mm.
because it changed hands like a lot of times, and I kind of
Oh,
like lost touch with the person. So I don't know.
I hope they learned their lesson or got their license revoked or something, or at least suspended.
Me too. Yeah, I don't know really anything about them. So
Damn. I'm glad you're okay now and
yeah, thanks.
recovered.
You were a great roommate, Jane. Don't worry.
Thank you. You don't have to say that, but
No, I think we were both like trying our best.
I think so. Yeah.
Yeah.
Yeah, you were still doing a lot. But I get that feeling of both the FOMO because it's your last year or last time in this
Yeah.
community. And so you want to soak it up as much as possible. But also when you're that age and so excited about what you're doing, it's like you don't want to stop. Like these are the things that fulfill you.
Yeah, for sure. Yeah, and I did and still do get a lot of fulfillment out of that. What I would tell my younger self is like just make sure I can commit and like be a bit more responsible, like
Mm,
following through, because I did like drop a few balls, and I
mm.
kept like most of them up in the air, but I dropped a few. So
It
yeah.
happens. As I've
Um
gotten older, I've learned to say no to things from the start
yeah.
because I have a better idea of projecting how much work things will take.
Yes. Yeah, inexperience like that was a huge factor. And it's still something I'm like learning because I when I do like evaluation projects at work or whatever, like yeah, it just takes a minute to figure out the scope. It's always different. Yeah.
Yeah, definitely. We've had a few conversations about this too as Canadians living in the US, but I wanted to hear, you moved to Atlanta to work for the CDC. Before we dig into the work stuff, curious to hear what were like the things that stuck out to you as a Canadian that you were like, oh, well, this is like very American and very different from what I know growing up.
I think how loud people were sometimes. Like or in general, very vocal, like just louder than
Like literally.
yeah. Yeah, the other big thing, which is partly like from being in the South, just how much like people would greet each other and acknowledge each other on the street. If you were driving a car, which is most people's situation, totally different story, and like pretend no one else exists in the world. But I would walk a lot and ride my bike and like encounter a lot of people and just like say hello, or we just make eye contact and nod, which I would have reverse culture shock whenever I come back to Canada because I would like try to make eye contact with people and they would just ignore me.
Interesting. That
Yeah.
must be a Montreal thing, because if you go to Vancouver, everyone's so like, you wave at all the strangers and say hello. Like every time I went on a jog, I'd like make 5 new friends.
Well, that's good to hear. Yeah. And I mean, in New York City, like no one would talk to me. Like, yeah, on my merry way.
Right.
Yeah, and I think like it might be related to what you mentioned about America being so big. Like there's such a wide spectrum of views, like opinions, everything. It was like it was the center of the universe a lot of the time. So I would often just like pipe up and be like, oh, this happened in Canada, or like there's this work being done in Canada. Unless there was like a disease outbreak in another country, like that would definitely be talked about. There's a bit of an erasure element too. It's like if I wasn't bringing my experience, a lot of people would assume that I was American or whatever.
Did you find yourself having to speak up more about that, whether it's like your own identity or just like reminding people that there's other perspectives?
Yeah, yeah. I think I felt that the most when dealing with like immigration issues, which
Mm,
was like a motivation to move back to Canada because that was just very stressful to deal with and like always uncertain. And yeah, a bit of a feeling of like not being able to settle down and not having access to the same stuff that like Americans did. And on the positive side though, like it was really awesome to be in a new place, like learn from my peers and be around so many like open and honest, like interesting and yeah, a diverse group of people. And the program that I did at the CDC was an evaluation fellowship, and then I stayed on to work on supporting the Ebola response in Eastern DRC, the 2018 Ebola response. Yeah, that was like just an awesome experience, and the resources available for public health work in the States, I think, are pretty amazing. Yeah, like the action orientation and the hard work that goes into like projects. Yeah, I was really impressed with that and was like honored to be a part of that work.
that's so cool. You were one of the first people I thought of interviewing when I started this podcast,
Aw,
especially because we're in a pandemic and I'm like,
yeah.
we need to have a public health perspective, and you literally just were working on the Ebola response. So can you talk a little bit about what evaluation means, like what your work looks like day to day, and then how you got involved in the Ebola response work?
Hmm. Yeah, so evaluation can look like a lot of different things. It's basically like analysis to answer key questions about a program or a project or an activity. Like those questions that we're trying to answer, questions about are we doing what we plan to do in this activity? Is it working to have the impact that we think it or that we want it to have? And like what's next? Or how could we improve to like make a bigger impact? I guess a method that applies to a lot of different fields. Like there's a lot of work in education, definitely in public health, health, but now there's like evaluations of environmental initiatives, can evaluate like policies, social work or social programs. Also, a lot of the methods are like transferable into business, and so
Got it. So it's like a reflection exercise almost.
yeah, yeah. That's how I like to practice it anyway.
Mm,
But a lot of people do like get taken aback, I guess, by the word evaluation, like especially when governments are mandating evaluations, or if you think about like getting evaluated in school, it
yeah.
can be like a loaded term that yeah isn't like welcoming or a happy fun experience. But
Right.
what I believe it is like the happier, yeah, more like constructive experience.
So in your case, what does that evaluation work look like? And like, does it tie into any funding results or anything like that? Like what's the like end thing that you deliver, and how does it impact an initiative?
Yeah, it depends. A key part of the evaluation is like engaging with stakeholders and planning like so that the results will get used, because oftentimes in history like we'll do these evaluation or reflection projects and it'll just sit on a shelf, and sometimes like we have to tick a box for the funders or whoever, but if we want it to truly be like an improvement exercise or like that reflective exercise, it should get used. Evaluations that I've worked on have definitely been more like qualitative in nature. So it involves like talking to people, trying to get as complete a picture as possible, and then present that in a way that's like where we can take key recommendations or look at the trends.
So in the case of Ebola, you were working on the response first in Atlanta, right? So you weren't on the ground yet. What kinds of work were you doing when you were, at headquarters?
The Ebola evaluation work was like slightly different. It was more of a monitoring project. So like checking in at regular intervals, what was the feedback? It was from a very specific piece of the response, because the response is like a huge structure with a lot of different actors. There's like people who are doing epidemiology, so like contact tracing and investigation. There are vaccination teams, treatment teams, and then the teams that we were working with were the part of the communications and community engagement piece, which is a lot of like talking to people, informing them, answering their questions. And then this feedback piece, which is what we were working on, was also listening to them, recording what they were saying, like if they had heard a rumor or like if they had a certain belief about Ebola, that would get recorded to get a snapshot of kind of what is the conversation right now in this particular area among these people. We call it community feedback, and it was collected by Red Cross volunteers from the Democratic Republic of the Congo Red Cross. Yeah, there were like hundreds of volunteers mobilized around the region to spread these messages like among their communities, because there are a lot of like key behaviors that people can do early on, like if somebody is sick with Ebola or potentially sick, that can really save lives. They also spread messages to like destigmatize Ebola, like reduce fear. At first, I worked with the team to start like analyzing this feedback, kind of see what was possible, and then it grew. And eventually I traveled to the Democratic Republic of the Congo, working mostly out of Goma to do like capacity building projects, because it's a country and a region that experiences like Ebola outbreaks pretty regularly. Like there have been 2 more in that country since the one that I worked on, to support like volunteers or staff in country to have the like analytic skills like for future projects and continue analyzing feedback without guess like having to wait for the CDC, or it's like a more efficient and sustainable system. And also we recognize that people with the knowledge of the local context, so like the Red Cross volunteers and staff, they are also able to like interpret what the feedback is saying a lot more effectively.
Okay, a couple questions. One, can you remind me some of the facts about Ebola? What are the symptoms and how does it spread?
Yeah, it's a virus, and it's a hemorrhagic fever. The symptoms like can vary: fever, vomiting, diarrhea. A lot of people think bleeding is a main symptom, but it's actually like not. It wasn't that common from what we saw. Yeah, stuff like headache, sore throat, cough, joint and muscle pain. So sounds a lot like COVID, right? Like it's yeah,
It's like everything.
yeah. The thing with Ebola is it's in the environment. Like we think that it's a reservoir, so like where it kind of like lives and is transmitted in bats. When people interact with the bats or like other animals that might interact with bats, we think that's how it outbreaks start in people.
So
And
similar to COVID in that way.
yeah, like the theory of like the pangolin, yeah. Which yeah, to my knowledge, like we haven't confirmed anything, but there's yeah.
But it's not as infectious as COVID.
I'm not sure actually. I haven't seen like comparisons, but the thing is it's very deadly without treatment. It can be over 50% like chance that a person will die.
Oh, wow.
Yeah, it's a lot better with treatment, but like it's high, and it spreads through bodily fluids, especially when the person is close to death or has died. So rituals and like caregiving acts are like a main time when it can spread, or within the healthcare system. Everything about health is pretty personal, but especially with Ebola, like it's transmitted through acts of love. Like caregiving, like burials, things like that. So yeah, that's like a huge cultural element in the Ebola response. And part of the value of like the feedback was that it could reflect some of the concerns or like experiences people had, and it would help the response like understand people actually living the outbreak and not just working in it.
So how, like with a proper Ebola response, like how would you take care of a body of someone who just died?
Safe and dignified burials were developed in the West African outbreak in 2014, and that like combines what you need to do to protect like everyone there. It also allows to take care of like the spiritual, mental, and emotional health, and this is like borrowing the medicine wheel concept, which is a way of understanding health used by a lot of indigenous communities in Canada and in other places as well. So it allows to take care of like other aspects of health and not just that physical element of like stopping the spread of this virus. If we ignore like those cultural, spiritual, emotional elements, then there's a big risk that people will like hide the possibility that this was Ebola, or yeah, and it leads to like more spread later on.
Yeah, it reminds me of COVID as well, in that like there's so much emphasis, and for good reason, putting in these safe measures that I think it's a little better now in hospitals, but in the early days, how patients who were dying from COVID weren't allowed to see anyone, like family, friends, like no one could visit. Just a few weeks ago, we had a doctor on this podcast, John Rhee, who wrote some articles about this when he was working in hospice care and had patients who were dying of other reasons, but they couldn't have family members come in because of COVID, which is obviously really sad. I like that you use the word dignified. Like it is not a dignified way to go.
Yeah, it's horrible. And also like my grandma passed away last month, and I was really lucky that I got to see her and say goodbye, but we hadn't seen her in a year before that because of COVID. So I think we're going to be feeling these effects for like a while, just grieving the time we've lost, the just that connection. Zoom doesn't I mean, not to call out Zoom in particular, it's just not the same, like not to be in person.
Yeah, I can't hug you through Zoom.
Right.
Yeah. I'm
Yeah.
sorry to hear about your grandma.
Thanks.
But
Yeah.
I'm glad you guys got to see her.
Yeah, me too. Yeah, really, really grateful for that.
Okay, so I do want to hear too about just your experience of being in the DRC. What was that like? Like, had you been to Africa before then?
No.
Okay, so that was your first experience on the continent. What
Yeah.
surprised you?
I think maybe like just the busyness of the streets. Like it was like just very fascinating. I would people watch like so much. I try to prepare myself like as much as possible, really, by reading stuff. Like obviously all the feedback gave me an idea of kind of like what people's experiences were, even though it was pretty short sentences and translated a couple times, and yeah. And I tried to like talk to as many people who had been before. I was lucky I had a few colleagues who had gone on deployments before me, so they answered all my questions. And part of what was really surprising was like just to actually see it and see the city and how it was set up and all the people. Everyone like hustles all the time. There's like stores set up on the side of the street, like just very different from any city I had been to before. What was really cool and surprising at the Red Cross was how much singing the volunteers did. They would just have regular like songs they would sing together, anthems, or like songs they would sing while exercising or dancing, songs to like welcome leaders and appreciate them. That was really lovely. And I learned a couple of them. Also, how quickly and often everything changes too. Like just how many, different teammates I had, how many, how quickly like priorities could change. And it was a bit of a shock to come back suddenly due to COVID, like because we were repatriated right at the start of the pandemic lockdown. So once I kind of came out of that, just like the shock of, okay, now nothing's going to change for a while. or not knowing that, I guess like the uncertainty was maybe still there, but going from everything happening at once to almost nothing.
It sounds like your time there, and like I get this picture of it being very fluid, like as a society and a place, like things are moving, people are hustling, but also like the singing stuff, like that's so cool. Like you would never see that at a Red Cross in Canada or the US. It's like you would go to a karaoke bar or sing at home. It's so much more like walled experiences, like certain activities happen in certain places.
Yeah.
But it sounds like a lot more open over there.
Yeah, for sure. Yeah. Oh, and this was another like awesome piece of it was on Sunday mornings around 5 a.m. Like we would start at 6. There was a kind of community like fun run or exercise every Sunday.
Wow.
It was like the whole town came out and was just working out. Like there were almost no motos or no minibuses driving around. Yeah, we would try to run like a circuit or go for a walk, but there'd be people doing like martial arts, doing, you know, sit-ups and push-ups, rollerblading, cycling, doing all kinds of sports. And it would finish up around like 7 or 8, and we would all go back and like have breakfast and stuff or go back to sleep. But
Wow.
yeah, it was really cool.
That is the most wholesome thing ever.
Yeah,
Like a whole town exercising together on a Sunday at 5 a.m.
yeah, it's amazing. Yeah,
Wow.
yeah.
Would they like go to church after?
Probably a lot of people would. Yeah, I think that was behind a lot of the timing, and then yeah,
Very cute. I don't
yeah.
remember the last time I woke up at 5. I don't think I will for a long time. But maybe if I had like a fun run
Yeah,
ritual.
I did sleep through like a few of them.
How
Just
long were
like
you there for?
so I was there with 2 breaks in between. I was there on and off from August of 2019 until March of 2020. 5 months total with like
Wow.
if you take out the breaks.
And then
Yeah,
you moved back to Montreal.
yeah.
Okay.
When I first started my fellowship, there weren't really like any outbreaks going on, so it was like unexpected, but also something I always wanted to get involved in because I remember learning about the 2014 Ebola outbreak and like just being so fascinated, you know, wanting to support somehow because it was such a like tragedy in a lot of ways. Like I'm just really grateful to have been able to work on the response. But yeah, I after living in the States for like maybe a year and a half, there are a lot of personal factors that showed me that I wanted to move back to Canada more long term. Part of it was like the context of, you know, not being a citizen and that underlying kind of like uncertainty or insecurity. And there weren't any like good solutions. Also, just missing my communities here and being a bit too far from family, like to be able to travel in an emergency, like wanting to spend more time with family. My brother had a few kids, so wanting to be around them,
The
which like
cutest
unfortunately,
babies ever.
yeah, they're awesome. Yeah, yeah. Shout out to Mason, Ruby, and
Oh
Raylan.
my God. For listeners, we have like a girl group text chat and Viv sends us like weekly baby videos and it's literally like my weekly dose of sunshine.
Aw,
Baby inspo.
yeah, yeah, they're awesome. But yeah, so I wanted to move back to Canada. Also, like I realized that it was kind of helpful to think of myself as an observer in the US. It was less frustrating. I think I heard somebody who's a documentarian like refer to himself as an observer and just like, wow, okay. Wish I thought of this earlier. But
Mm,
because it like there's so many restrictions on what you can actually get involved in politically, plus like the arbitrariness of if I'm ever arrested or something, like my visa can get snatched away,
mm.
that kind of thing, and then I lose my job if I lose my visa. Yeah, that type of like underlying insecurity. Plus, there's all this stuff going on in the States, and it's the center of the universe when you're there. But there's other stuff going on in Canada, like other injustices. Like I remember like the Colton Bougie murder. Yeah, and where like George Stanley was standing trial for that. I remember that happening, and I just felt like I want to be there and witness that and like participate, be a citizen. Yeah.
Yeah. I mean, you want to be a whole person, but it's cool because it sounds like you are able to apply a lot of what you learned through working on Ebola and working at the CDC to your work now, where now you're supporting the COVID response in Montreal. And maybe this is a good time to, check in on that Post-it note about the Dalai Lama Fellowship.
Yeah. So, okay. So how did I learn about Dalai Lama Fellowship? I think it was like something that always got advertised through McGill, and it was money to do a project plus a curriculum that would bring like different people together, like mostly younger people from around the world who had an idea for a social change project or like project to benefit a community. We would learn like compassion, self-mastery, and I think mindfulness. Yeah, I wanted to just give it a shot, but I didn't like have a project in mind. But I was learning about indigenous health and just thought this would be great to put towards like disparities or like towards improving health equity and some kind of reconciliation. I had experience in in studying sciences and like sexual health, especially like I was volunteering as a facilitator doing sexual health workshops. So I applied and I was accepted to the fellowship. In my proposal, it was a train the trainers model, emphasizing that it was like by and for youth affected by a certain like health equity issue. Then once I got accepted and did like found out more about what the project was about, I reached out to a couple of organizations to try and see like if we could make a partnership. And I reached out to the Native Youth Sexual Health Network, and through that was connected with somebody in Kahnawà who ended up facilitating our project, and I supported her. And the project was called Skatne Yumpate Hiaruje, Our Families Grow Together. And it was a series of workshops for attachment parenting, sexual health, reproductive health. This was for like young caregivers in Kahnawà. Yeah, I learned just so much from that experience, like about solidarity and allyship and like working together kind of cross-culturally. It was just a lot of fun. I would do a lot of like finance work, cooking and like preparing food, a lot of logistics stuff. So we did that for about a year. The Dalai Lama Fellowship, like outside of the project, was really important in ways that are like still revealing themselves now. I think like a lot of the skills and discussions I had and the people I met, I still come back to that, and I try to like ground myself in those memories sometimes and like reconnect with the community. Yeah, it taught me like a lot of skills like mindfulness and self-mastery that are helpful during the pandemic and during like challenges I could face at work now or like just in life.
Yeah, I feel like I could use a program like that right now.
Oh yeah. Just like
Um,
breathing exercises, for example.
yeah.
And
Oh man.
self-compassion, that kind of thing.
I miss going to in-person yoga classes that were slightly spiritual, where you'd like have a part of it that was meditation practice.
Yeah, just like being in the present and both like accepting whatever crap is going on in the present and like being grateful for the good things we have. So a lot of the pandemic for me has been like waiting for stuff. I feel like sometimes I'm going to be waiting forever. So like just remembering to be in the moment and accepting the circumstances we have.
Yeah,
Yeah.
that's a good reminder. Do you want to share a bit on the work that you're doing now?
Yeah. So I work in Kahnawà again. But this time I'm working full time for Ungwadagari Datsara, which is the one health and social service agency in Kahnawà. And you said earlier supporting the COVID response in Montreal, but it's really some parts of my job are supporting the COVID response in Kahnawà, so on the territory. Kahnawà is a Kanien'kehá:ka territory just south of Montreal. Yeah, I guess I should have said this at the beginning, but all that I've shared is my own opinions and experiences and views, and I'm not representing any of the organizations that I have worked for or Ungwadagari Datsara, who I work for now.
I have one last question for you,
Yeah,
which
sure.
is you give so much of yourself to your work and the communities that you serve and the people that you work with. How have you stayed whole through it all? And what are some of the lessons that you've learned about how you can take care of yourself while, working in public health and caring for others?
Yeah, I don't know if I have stayed whole. um, yeah, I think I'm doing better now, but I feel like I've built my resilience back quite a bit. But finding a balance between like burying my head in the sand and waiting till I'm ready to deal with stuff. And then, yeah, just like accepting my feelings when I am dealing with stuff, trying to stay compassionate with myself, let myself feel my feelings, like the grief, the uncertainty, telling myself it's okay to slow down, and trying not to stay like too much in the past. Because I realized I was doing that a lot, like ruminating or thinking about past stuff that I'm not even sure if I'm remembering it correctly, and just focusing on the connections that I have, and just staying in the present and a little bit in the future, like the hopeful future, and talking about just how this is affecting all of us. That helped me like a lot. Just telling people like, yeah, I'm feeling down, feeling a bit depressed, like that kind of thing. That helped a lot. Still something I'm working on, self-care. Honestly, it's something I've like been working on for several years, and I have a lot of tools, but using them is another story. But I think
Don't let them rust in your tool belt.
yeah. One realization I've had is like it's hard to get back into routines and stuff when I do face a setback or like have a change in my environment. So I think paying attention to those like key moments and trying to really focus on self-care in those like transition times, and have like just having something consistent that I do.
What is that for you?
Right now I would say it's like talking to friends and family. For a little bit it was like running while I was deployed, but then I got injured, so that was an example of a setback. Tea really helps. Yeah.
I remember, didn't you have like a little red teapot?
Yeah.
Do you still have that?
It's stuck in Atlanta right now. I do still have it, yeah. I've like fixed the lid so many times on that because it would always break.
Oh, no. The lid. Well, this has been a great conversation.
Thank you so much, Jean.
All right. Thank you so much for listening and watching today's episode. Let me know what you thought in the comments below. I'm excited to see you guys again and talk to you next week and share my own story. Be sure to subscribe wherever you're tuning in, and I will talk to you then. Bye.